Hey, Dr. Tyler Williams with Better Sleep SLC, and you're here today because you have some questions about snoring or sleep apnea or wearing an oral appliance. You're definitely in the right place. That's why we make these videos, is to share with people like you who are trying to figure out the best options for you or your bed partner or spouse. So I'm going to go through 6 benefits of an oral appliance and how they may be able to help you or your loved one get a better night's sleep and feel better. So the first one, of course, is to treat your snoring and your sleep apnea. So the sound of snoring obviously can be annoying or keep us up at night if we're the ones dealing with our partner who's snoring, or it might even wake you up if you're the one snoring. But on the sleep apnea side, is most people who snore will also have some type of sleep apnea or other sleep disorder, and that can cause things like high blood pressure, stopping breathing during the night, morning headaches, whole bunch of other medical issues associated with that, heart disease. When you look at some of the people in the acting world who've recently had issues with this, Carrie Fisher comes to mind. She actually died from sleep apnea, and she, because of all the complications that can come from when it's untreated, it can be even fatal. Right. So that's the first one. The second one is sleep apnea and breathing. Okay, so what are your breathing, your day-to-day breathing, what's that like, right? Is it something that you're a mouth breather, a nose breather? Do you sleep with your mouth open? Do you sleep with your mouth closed? But it can help you do some of those things. We know that breathing through our nose is generally the healthiest, best way to breathe, but when there are blockages in our nose or our mouth, it can make that more difficult for you. And so with an oral appliance, it can help you keep your mouth closed when you sleep, and there's some different ways we can work with your appliance to do that. It does a couple things. It keeps your mouth hydrated, which is better for your teeth and less likely to get allergens and pollens and those kind of things. You also won't wake up with a mouth that can be dry or uncomfortable or itchy or scratchy throat. And wearing an appliance can help with that quite a bit. Helps with your breathing. When you breathe through your nose, your body has more filters. So our nose, we have nose hair and all kinds of things in our sinuses. That helps filter out, things that can cause allergies and things that can irritate our body. And even though they can be irritating coming through our nose, the nose is much better at filtering them out than our mouth is. So it can save your teeth, help your nose quite a bit. The third way an oral appliance can benefit you is how it protects your teeth. So most people with sleep apnea, I find, either clench or grind their teeth a lot of times without even knowing it. And so the oral appliance, not only does it help you sleep better, breathe better, calm your snoring down, sometimes even make it go away completely, but it also helps protect your teeth so that when you clench or grind, the appliance absorbs the shock and the impact rather than your teeth. Think about when people get knee surgery a lot, it's because they've worn out the cartilage and now it's bone on bone, and that's very destructive to your knee. Well, our teeth are very much the same. Normal chewing is totally fine for our teeth because your teeth are the hardest thing in your body. They're much harder than bone, but if you hit 2 rocks together sideways over and over, it can cause damage, especially if there's not something between them. So when you're chewing food, that food is between your teeth, that cushions it. But if you don't have anything between your teeth and you're knocking your teeth together, that can cause a lot of damage that can give you some big problems. So the oral appliance will protect your teeth, and it will protect your bite, helps you avoid things like crowns, implants, root canals, those things that none of us want to go through if we don't have to. And especially if you had a lot of dental work done, or you're going to have a lot of dental work done, you're going to want to save your teeth and implants for as long as possible. The fourth way we found is people have fewer headaches. So with the appliances, a lot of times this ties into TMJ issues, but if you have TMJ issues, we find the appliances help that. There are some older ways of treating it, and some of the older appliances that people found could cause TMJ problems. That has not been our experience doing this for almost 12 years. most of the time people see an improvement. Sometimes not much, but most of the time people see a good amount of improvement with their TMJ, because TMJ can be linked to poor sleep quality, and that can cause headaches and migraines. Also the clenching, the muscles. When you have an appliance made, you should ensure that your providers are checking your chewing muscles, because just there's a type of an exam we do where we check out your chewing muscles, and we can see where you may be clenching or where your muscles are overstimulated or overworked, and that helps us design some things with your appliance and everything else. All right. The fifth way is keeping your teeth from shifting or acting kind of like a retainer. So if you've ever had orthodontics, braces, Invisalign, you know that without a retainer, your teeth will relapse. All right. I think about it a lot like the way that when we work out, and get in shape and eat right, our body will get in shape. But if we quit working out, quit eating right, what happens? Of course, we'll relapse and it will go back to the way it was before, and teeth will do the same thing. So when we make when you have a sleep appliance made, it'll fit your teeth in the shape that they are currently, and that will hold your teeth in position so that they don't get crowded or relapse. Now, it's not going to fix things. So if you have some teeth that are a little bit rotated or crowded or crooked, the sleep appliance isn't going to fix that, but it certainly will keep it from getting worse, because every night you wear that, it's going to remind your teeth to stay in that position and not drift. If you have something like Invisalign, or you've had braces, and you have a removable retainer you're supposed to wear, generally this will replace your removable retainer, which is something you have to wear anyway. So it's really nice because you kind of kill two birds with one stone, so to speak, where you'll be able to keep your teeth straight and improve your sleep and health and wellness and those kind of things. The sixth way is less dry mouth. So we talked a little bit about this before with breathing, but with an appliance in, you may find, at least initially, you salivate a bit more. That's actually good. Your teeth need lots of saliva. The saliva in our mouth picks up minerals from the foods we eat, and that's actually how our teeth and our enamel stay strong. And so I treat a lot of patients with dry mouth disorders, and dry mouth is one of the hardest, most damaging things on teeth, because over time, every day, a little bit of the calcium is pulled out of your enamel, and your teeth gradually get more brittle, and then you get cavities and root canals and chipped teeth easier. So when you have an appliance in, we can use it to help you salivate more. There are even some special gels we can prescribe you can put in your appliance that will help give your teeth vitamins and keep them moisturized and keep minerals in there, especially if you have dry mouth. And then just the way we design the appliance can also help you keep your mouth closed better, so that it's not opening so much during the night, which causes dry mouth. So that's kind of a quick overview of 6 benefits if you choose an oral appliance. We've been providing these for almost 12 years, and they are a fantastic way to help you sleep better, feel better. They're not the right option for everybody, but I can tell you the success rate is really high. So it's important you just sit down with your sleep team and talk about the options available to you and get a proper diagnosis from a sleep physician. If you need some help with that, you can click or call or text us below, and we can get you a telehealth consultation where you can actually get a home sleep test that's sent to your home. You don't have to go to a doctor's office or a hospital, and then you can get screened that way to find out what type of snoring you have and if there's something else involved as well. So thanks for taking a minute to watch this video. Please leave your comments below, and we look forward to seeing you on the next one. Thanks.